Happy March! Not only is March a great time for Michigan State basketball fans such as myself, go green, March just happens to be National Kidney Month, National Nutrition Month, and National Women's History Month. As a woman-owned business all about kidney nutrition, it's pretty much a month all about Melanie. And to celebrate, I'm offering a ton of different discounts and freebies all month long. Make sure you're on my newsletters list so you don't miss anything. You can head to kidneystonefreebie.com to make sure you're on there. Also, I have a special offer just for you as a listener of the Eat Away Kidney Stones podcast. I'm giving away free VIP enrollment to my signature course, Kidney Stone Nutrition School. To enter for a chance to win, all you have to do is leave a review for this podcast wherever you listen to your podcasts, take a screenshot of the review, and email it to us at hello@thekidneydietitian.org by March 31st, 2025. Good luck and happy Kidney, Nutrition, and Women's Month. Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Hello and welcome to the 85th episode of the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. And today we have a very special guest on today. We actually have a nephrologist, Dr. Paul, whom I met. You reached out to me, right? I'm actually blanking on how I met you.
Yes.
Yeah.
My friend Will contacted you.
Yes,
So
right.
you were on our podcast, and
Yes.
my medical assistant, Ian, is the one that actually found you. And I had a patient that follows you
Oh, so
regularly
fun.
too on
Small
your
world.
social media.
Yeah,
Yes.
small world. Well, I was so excited that you did reach out because Dr. Paul is a nephrologist who is extremely interested in kidney stone prevention. And as we've talked about with other guests, not all nephrologists or even urologists are necessarily really invested and have a thorough understanding of kidney stone prevention. And so whenever I find a fellow dietitian or a doctor or any healthcare professional that is as passionate about stone prevention as me, I'm super pumped and want to just kind of share the word. So, Dr. Paul, thank you so much for being on the podcast.
Yeah, I appreciate you having me.
Yeah. Do you want to let's start out by just sharing a little bit about who you are, where you are, and what you do?
Yes, so I have been a nephrologist, if you include my fellowship training, for 30 years. This year's my 30th year. And I work in Orlando, Florida. I've been here for 11 years. I worked in Central Illinois for 15 years before that. And so I do the full gamut of what nephrologists usually treat, which includes dialysis patients and post-transplant patients and chronic kidney disease patients. But I've had a focus ever since fellowship on kidney stone prevention. So that's continued throughout my career.
That's awesome. That's, in my experience, it's kind of rare to have that kidney stone focus. So, what was it about your fellowship, or what is it about working with people with kidney stones that's so appealing to you? Why do you like it?
Well, I like it for a few reasons. Um, a lot of times we're dealing with sick people, and fortunately, the kidney stone patients generally are healthier. So that's a bit of a change of pace for me, which is nice. And then secondly is if if you find a patient that's made multiple stones over several years, and you work them up and you treat them and they quit making stones, you now have a new best friend.
Hmm.
So I find it, the patients are very motivated to get evaluated and follow through with treatment. And it's very gratifying if you can help them solve this problem that they've been having to shoulder the burden for such a long time.
Hmm. Yeah, I know we've talked previously about how rewarding it is to help someone who has had hundreds of stones potentially, right? And been dealing
Yes.
with them for decades and have kind of gotten the message previously that, there's not really much we can do, like maybe just drink more water. And to have a full workup and work with someone who really knows what they're doing, like it's life changing for people. Unsurprisingly, not that, this is preaching to the choir of the listeners of this podcast, but it really is life changing. And that's pretty cool.
Yeah, one of the first patients I took care of after I finished fellowship, um, actually was a family member and had been making stones every few months for 20 years. And I said, well, what advice did you get? And he said, oh, I was told not to drink any milk. And
Oh
I
my God.
said, well,
Ah.
that's right. Right. So I said, that strategy doesn't work too well
Well,
for
that's
you,
actually
does it?
harming you quite a bit. Yep.
So right, so
Hmm.
so I got his urine and treated him, and he quit making stones.
Yeah.
And so I'm thinking, is it really that easy? And with a lot of people, it is. And
Hmm.
and so you just get, you know, you feel so bad for somebody. A lot of times the patients will say, "Why didn't I find you 10 years ago?" And
I
I
know.
say, "I don't know why, but you're here with me now, and we're gonna fix this and move forward." So
Yeah.
usually there's probably 80-90% of the people you can treat them and so that they're not stone
Mhm.
formers anymore.
Yeah.
So again, that's very, very rewarding. It's also a nice for us because it's very objective.
Hmm.
We
We can look
measure
at
the
that urine
24,
test.
yeah, we get the 24-hour
Hmm.
urine. We know why you're making stones for each specific person because it's not necessarily one size fits all. And so we deal with that patient's specific issue or issues. And then we have a way to measure it after we've treated them to say we've corrected it and
Hmm.
you shouldn't make stones anymore.
Right. Right. And even if they are making stones, which often is not the case, I get a lot of people who come to me who say, oh, my urine test was totally normal, but I'm still making stones. And my response is, well, clearly that urine test isn't normal for you. Like, I guarantee we can find something on there to improve. The normal ranges on those measures are pretty subjective, and you kind of have to interpret them sort of as a whole. So, this is I say this all the time in all of my content, but that urine test is so critical to know to really come up with that effective plan, like you're talking about.
Yeah, so a couple of things there. I mean, what I tell patients is, any stone that you have existing in your urinary tract is there,
Right? We
and you'll
can't
have to deal with
dissolve
that
it.
with the urology. Exactly. They say,
Hmm.
well, can't you give something to dissolve it? And I said, if we can give you something to dissolve it, then I'd worry what it would do to your stomach or your
That's a good
kidney.
point.
Uh,
Yeah.
First of all. Secondly, I said if you drop a pebble into a bucket of water and you come back a year later, you're still going to have a pebble in the bottom of the bucket. And so that doesn't change.
Hmm.
But so that's the first thing is I tell them if you're passing stones, it might be something that was pre-existing.
Yeah.
And the goal is that you don't form any new stones or whatever you have in there doesn't grow larger. And then secondly, stuff, happens to people and they get a new risk factor. So what I tell them
Hmm.
is if you think this is a new stone, you had an imaging study that said, hey, this stone wasn't there last time we imaged you, then I just repeat the 24-hour urine and say, maybe there's something that's changed with you. And that's happened to me too, where somebody will
Yeah.
come back and they've been stone free for a number of years. And then I work them up. It's like, oh, lo and behold, you got a separate new problem. Why is that?
Hmm.
And then you address it.
Yeah. Yeah, that's a good point. I talk a lot about kidney stone prevention because there's nothing me or Dr. Paul can do to get rid of stones that are in you already, but there is a lot that we can do to stop more from forming. Um, Yeah, so that's a really good point. And I think also that kind of highlighting the need for long-term follow-up with a stone prevention specialist, right? Because I think it's very common for people to form, say, women especially, to form calcium phosphate stones when they're young, and then maybe that'll switch to calcium oxalate stones, right? Or your risk factors change, right? Like your diet changes, your body changes, your environment changes over decades, obviously, right? So it's really important to kind of keep up with those urine tests. I would say ideally annually. Would you agree in a perfect world? If
Yes, I mean that's usually my strategy. I'll
hmm.
say if I've got them in remission, I follow up
Yeah.
with them once a year just to make
Hmm.
sure things are copacetic and if something's changed, then we can address it. But most of the time, people are real stable on treatment and
Yeah.
we're just sailing along.
Yeah, absolutely. Absolutely. I love another thing that I like to think about is, the stat is always thrown out that once you have a stone, you have a 50 up to 75% chance of having another one in your life. And that's so like heartbreaking for stone formers. And I always wonder, like this is what kidney stone nerds think about as we're laying in bed, like, huh, I wonder how much lower that recurrence rate would be if everyone saw a Dr. Paul and a Melanie, right? Like, I wonder how much lower we could get it. And it's impossible to guess, but you threw out a number. And so that was exciting. You said
Well,
80
yeah,
to
and
90%.
that I can
Um,
fix. Now, the question
yeah,
is, I mean, so the dogma that we have is if you make one stone, okay, we'll let you do that. Because like you said, half the people will only make one stone and never make another
right,
one.
right.
But half do. And so typically we're waiting until they've had at least two stones to work them up. The exception to that is, I mean, I've had a couple of patients that got really bad urinary tract infections because they had effectively an impacted infected urine from the stone
Hmm.
and became septic. And I said, we're going to work up your stones because you don't ever want to do this again
Yeah.
because you're in the ICU, really sick. So I've had a couple of those. So that's the exception. Or if it's something that's super huge, it's like, why do you have a,
Yeah.
15 millimeter stone? That's a little weird.
Hmm.
It took a procedure to get it out. But
Hmm.
but you're right. And if somebody comes to me, they've made one stone, I'll tell them, "Well, I'll work you up. It may very well be normal, and this is just a fluke. But if you're making two or more, I mean, what I say is one's a
Something's going on.
phenomenon, two or more is a trend. And we got to
Hmm.
figure out why you're trending that way.
Yeah. Yeah, and it's never too early is kind of what I'm hearing you say. It's never too early to get worked up for stones. Even if you have had one stone, if you're really motivated and you want to work with a kidney stone expert, you totally can. We're not going to say no, like just wait, right? Although that is oftentimes the norm, but you don't have to wait. You can
Yeah.
totally get that urine test and work with someone if you're super motivated and want to do everything you can for prevention even after just one stone.
Absolutely. And I do get patients like that. And you're exactly right. That's their personality is they're very
Hmm.
motivated. I don't want this ever to happen again. What
Yeah,
can I do to keep this from happening again?
right.
So
Right. So, very opposite of the conversation that we're having right now on this recording is that I feel like I'm going to venture to say most patients with kidney stones get the message that there really isn't much that you can do to prevent stones. I feel like a lot of people will say, "Oh, my doctor just said I'm a stone former. This is just, what God gave me. There, this is just my life." What's your take on that? What do you have to say to that?
I find that tragic
Hmm.
because oftentimes there is something you can identify. And I don't know if they've gotten bad advice or, I can't conjecture what other clinicians are doing, but I will say there's a lot of people that are very discouraged and, these are usually people that have had multiple stones and they've asked those questions already, like, why am I doing this? What can I do to prevent this? And whatever advice they are getting clearly isn't effective because they're going back with more stones. So that's usually the folks that you and I see.
Hmm.
And so when you can share with them strategies for preventing stones, again, they're super excited and motivated. And then when it turns out to be true, then they're just so relieved that they don't have to worry about this ticking time bomb that's going to go
Hmm.
off in a year or two where they're going to pass another stone.
Right. Right. Yeah, I think kind of the standard of care for people with kidney stones does not include prevention. Um, Tell me if you disagree, but I think, as evidenced by the fact that less than 10% of people with stones will ever even get a 24-hour urine test is just very telling that patients are not typically worked up for a targeted, effective prevention plan, and that is heartbreaking, and that's exactly why I do what I do.
Yes. Yeah. So right. And so and again, it's who, the urologist a lot of times they're dealing with the intervention of
Right.
the acute
They're
stone.
surgeons,
And
which is
right. And so
important.
they're not, yeah, and you need them. I mean, that's
Yeah.
what I tell people. You're passing the stone, don't call me.
No.
You need to talk to your urologist.
Yeah.
So I get that periodically. But again, that's not necessarily their gig. It's almost like you wouldn't go to a CV surgeon to figure out how to treat your heart failure. You'd go to a cardiologist,
Hmm.
and so
Yeah.
it's kind of, I mean, can the CV surgeons, do they deal with patients with that? Yeah, but it's not really their gig to
It's not their
to
focus.
yeah, to minimize their heart risk. That's
Hmm.
more the cardiologist role. So same thing
Right.
here. A urologist is going to treat your acute stone issue, but not necessarily be the best person to maybe some are, but some, they're focused on doing the cystoscopy or in the stone retrieval or the lithotripsy or whatever they need to do
Hmm.
to take care of that acute stone issue.
Yeah.
Um,
So I've asked this to physicians on the podcast previously, and it's a hard question to ask. So you can step back if you don't have a good answer. But what advice would you give to someone who wants to work with a nephrologist for stone prevention? So how, with knowing that not all nephrologists really focus on kidney stones, what advice would you give, people all over the world to find a nephrologist that is going to really understand those 24-hour urine tests and really know how to prevent stones from a medical standpoint?
and I don't know if I have a great answer for you, and I'm not afraid to take on the question.
Top.
But you're right. It's just like not all nephrologists are interested in this, which kind of baffles me because I find it like very, like I said, gratifying and
And such a
interesting.
need. Such a
And right,
need.
there's a huge need. So the best thing I can say is find out who's a nephrologist, a practice close to you, and call them. Because if a patient calls our office and says, "Hey, I would like to get a workup for kidney stones," because we're getting patients referred to us from other physicians. The stone patients are the one group that is going to come in off the street looking for us. And so what I would say is if you call a nephrologist office and say, "Hey, I'm interested in kidney stone workup," but then I would ask them specifically, are any of your physicians, do they have a focus on kidney stone prevention? And what'll happen if somebody calls our group, then they'll say, "Oh, go to Dr. Paul. He's the kidney stone guy." And so
Hmm.
I tend to get the far majority of those. I mean, some of my other partners like doing it and they do them, but I'll get the bulk of those patients. And so that's
Hmm.
probably what you want to do. And if the answer is nobody here really has expertise in stone prevention, then maybe you want to shop around and look for a different nephrologist.
Yeah.
So that's probably the best thing because I can't there. I mean, and truth be told, maybe that'll change if we can network these things
Hmm.
and say, here's the closest nephrologist to you that's interested in stones. That's something
Yeah.
I'm interested in trying to create. So,
Yeah. I wish there
but
was like a certification or like a specialty that patients could search and know that this doctor specializes in that, right? It's kind of I wish that existed or some
well,
way to identify a doctor that
now
does
you're
this.
making me think, Melanie, because for example, the patients with polycystic kidney disease,
Hmm.
their entity actually uh, will certify different centers as having
Right.
an expertise in managing patients with
Yeah, that's
polycystic
very
kidney
true.
disease. And
Hmm.
there's two levels, and so we're actually looking into getting the first level. Do you have the imaging capability and surgery, and interventional radiology, et
Yeah.
cetera, et cetera. So I think it'd be possible to have something like that if there was some entity and you could register with that entity and say, yes, I'm a kidney stone prevention,
Yeah.
provider.
Yeah.
That would be something interesting to do. And so who would do that? You probably would know the organizations better than me. I don't know if the National Kidney Foundation would do that or they're
Yeah.
more about CKD, but
They are definitely more
somebody.
about CKD. There's actually a brand like less than a year ago, because it is kind of again kind of going along this trend of talking about that, kidney stones just aren't represented well in healthcare education or in systems. There really isn't like a foundation for kidney stones, right? Like there's the National Kidney Foundation, there's going to be the American Heart Association, there's American Cancer Association, right? There's all these big associations, nonprofits for essentially every healthcare condition or every health condition under the sun, but not kidney stones. But just a year ago, I know that a group of urologists and nephrologists and one dietitian started the Kidney Stone Collaborative. Yes, that's what it's called. So it's very small, like literally has been started within the last year. So if they grow, I feel like that could definitely be something that they could do to really really help patients because I get that question a lot is like, oh, like who can I go see? And it's, I say maybe start with like large academic medical centers. I think that you may find more likely to find a stone group there. But other than that, just kind of asking like, hey, what's your familiarity with kidney stones? But if we had like a systematic way of identifying institutions or doctors that are specialized in this, that would be wonderful.
Yeah. Well, and I mean, yeah. And we did have a stone prevention clinic at University of Michigan where I trained, but Yeah, I mean, a lot of community nephrologists will be good too,
Hmm.
because they're,
Right.
I'm dealing with patients on a regular basis. I just did some continuing medical education, and you always have to fill out the survey when you're done. So it's how much your time is spent in clinical care, 75 to 100%, because it's 100%. How much time do you
Yeah.
spend in research? Not much, but and so because I'm taking care of patients on the front line.
Hmm.
So that's sometimes who you want to see too, is who's regularly seeing patients and
Hmm.
not working in a lab or something,
Yeah. Yeah.
Um, but so but whatever, shop around and try to figure
Just
out if
ask. Just
yeah,
ask.
just absolutely just
Hmm.
ask. Doesn't hurt.
Yeah. Yeah. All right. So the big question, what can you do to prevent stones as a doctor? I know I have my answer as a dietitian, but as a doctor
Well, now
that
I'm on the spot.
what's your answer to that?
Well, so what I the first thing I tell patients before I've worked them up is here's the general stone diet, because everybody wants, like, they want to drink pomegranate juice and never see me again. Okay. So they want some secret elixir cure. But I'll say the key thing is you want to take an adequate fluid. So the recommendation typically is for 2.5 liters a day, and you want to spread it out through 24 hours. What I tell them is if you have a golden yellow urine, you didn't drink enough water since or fluid since the last time you voided. And that's when people a lot of times are making stones overnight, because they'll drink a lot during the day and then they don't have anything from supper till breakfast time. And they wake up and have a very concentrated urine, and that's when they're going to make stones. So I tell them you got to take something right before you go to bed, and
Hmm.
you're going to have to get up and use the restroom in the middle of the night, and you're well suited to have water at your bedside and just take something before you go back to sleep.
Hmm.
And that's what you're trying to avoid. So that's the first thing. The
Yeah.
second thing that you and I hit on is sodium restriction in the diet, because that's going to increase their calcium excretion in the urine. Third, and I've had a couple of these lately, is you know have more of a plant-based diet rather than animal protein, because I've had a couple of those, like I said, just within the last few weeks.
Hmm.
Um, and that's a nice thing when we work them up. Well, they'll say, well, how much am I? I'm like, when I get your 24 urine, I'll know how much you took at least that day. And if
Hmm.
that's your regular diet, I'll know how much, protein you're taking in. And then lastly, like you and I were kind of baffled with before, is a lot of times patients will avoid calcium in their diet. Either that's what they think is the right thing to do, or that's something they've been told to do. And actually, when the calcium, so normal, you can correct me on this, but normal calcium intake is 1,200 to 1,500 milligrams a day. And in the study that looked at this, as a retrospective study, and I remember when it came out, I'm so old now, it's from the early 90s. But once the dietary calcium was below 800 milligrams, the stone rate went up.
Hmm.
And people are like, that doesn't make sense. We've been telling people forever not to take in calcium if they're calcium stone formers. But actually, the thought is that then they don't have the calcium in their diet to bind the oxalate, either in the food, or that the bacteria in our intestine are producing, and so then they have this excess oxalate that's getting absorbed and then filtered into the urine to make a stone. So
Hmm.
that's the thought behind that. So
Yeah.
so that's the general stone diet that I tell folks to start off with, and then we get into the specifics with them with the workup.
Yeah. Yeah. From a medication standpoint, I think of two big classes of medications
Mhm.
that are most often used to prevent stones. I think of potassium citrate and the whole class of thiazide diuretics. So, can you talk a little bit about what those two medications are and how they prevent stones? And
Yes.
also, if I missed
So
anything.
yeah, so thiazide diuretics are a class of diuretic that are called calcium sparing diuretics. They work in the kidney, in the part where calcium is put into the urine. And so they'll reduce the amount of urinary calcium. And a lot of patients that make stones, they're what we call renal leakers. They just leak calcium into the urine, and we don't know why. And there's probably a mishmash of reasons. So this is a general approach that works on, the far majority of them. There's still some people that have high urine calciums after a thiazide. Then I got to scratch my noggin and say, why are you doing this? It's something else is going on. So I keep hunting around.
Hmm.
So that's thiazides. Most people in the United States are on hydrochlorothiazide. I personally use indapamide, um, because it's got a longer half-life. And
Hmm.
so thiazide's got a half-life maybe 18 hours. So I always worry, are they going to have a period where they're low thiazide level and they're going to put more calcium in their urine. And Dapamide's got a true 24-hour half-life. That or chlorthalidone. Those are
Yeah.
the two that you can use. And they're all cheap because they're all generic. And
Hmm.
Dapamide's, on the generic GP list.
Awesome.
So
Awesome.
that's
So those
thiazide.
those thiazide diuretics will help
Yes.
lower urine calcium, sounds like is the main take-home message.
Yes. And then potassium citrate you mentioned. So, and this astounds me. I've had a few patients. So it's in the United States, it's packaged as a sustained release because again, you don't want to take it all at once. It's like drinking your water all during the day.
Yeah.
So you want some of that citrate going into your urine throughout the 24-hour period.
Yeah.
So typically you'll take it twice a day and it's, um, 10 to 15 milliequivalents twice a day. And you can take that. There's a couple of things. One, they're horse pills. And so patients don't necessarily like them. And potassium, it can be a bit, give you some stomach upset in some patients. So, um, so sometimes I'll even use just potassium citrate powder that you can get
Mm-hmm.
over the counter. It's a lot cheaper, and the potassium citrate pills should be cost nothing because potassium citrate's super old. But I'll have some patients and they'll call and say my copay on that medicine was really high, and I'm like, that's crazy because
Mm-hmm.
stuff's been around for
Yeah.
eons.
Healthcare in
It's
America. You
right.
know.
So then I'll try to get them something to citrate a different way that's
Yeah.
not so expensive.
Do you ever recommend, there's a whole host of different, like drink powders, like Moonstone and Litholite tend to be the two that are most common that I see. I feel like those can be a really good option for people who don't tolerate the potassium citrate or just prefer to take the drink powder. So do you ever use those types of things for people who have that low citrate?
Minimally, only because typically the citrate in there is like you get 99 milligrams. Okay. And when
Mm-hmm.
I'm treating people with like 15 MEQs, it's like 1.5 grams.
Yeah.
So like I'm giving
Hmm.
them, I go, you can take that, but you got to take probably 15 of those to equal what I'm
Yeah.
going to give you. So there's not a lot of bang for your buck, but they include other stuff for hyperoxaluria. They'll have B6 in them. Trying to think what else they'll have in there. They'll have citrate, they'll have magnesium
Magnesium
because
usually.
magnesium's the
Hmm.
stone prevention electrolyte. So I don't typically use those a lot. And then what I find is if people say that the potassium citrate pills are bothering their stomach, then I'll say, get your 2 liter bottle of water and put in 2 grams of potassium citrate powder and just
Hmm.
drink it over the whole day.
Hmm.
And that way it's not something that's so concentrated that's bothering their stomach. They tend to tolerate that better. So
Yeah.
I've done that in a number of people.
Nice. And that you said that powder tends to be cheaper too if cost becomes an issue.
Yeah. So now Foods makes it. You can go on Amazon and you
Oh,
can
okay.
get
Oh, you just
a
literally
12
buy it.
ounce
Okay.
can. Yeah, 12-ounce can for $10. And that'll
Awesome.
last you a couple months.
Yeah.
The
Yeah.
key thing is there's a couple different preparations. You got to make sure you find the one that says pure powder. If
Hmm.
you find the one that just says 99 milligrams, then it's like, that's not the right one. Get the other one.
Yeah.
Because the labels look exactly the same. Otherwise, they're kind of this orange label. And it's
Yeah.
like, unless you look at the fine print.
Yeah.
So,
Yeah. And I just want to caution people who are listening. Citrate can be a wonderful thing for some people, but it's definitely not necessary or helpful for everyone. So definitely ask your doctor and look at your 24-hour urine test with them to know if citrate is something that's beneficial. Because I think, people talk about lemon juice as being this like cure all for kidney stones, and it absolutely isn't. You need to have a lot of lemon juice to make a difference if your urine citrate is even low in the first place. So citrate is wonderful, but it's not necessary again for everyone. So,
yeah. So
mhm.
yes, a couple of things there. Yeah. So I'll push up because sometimes again some of these people it's like a few of those calcium people, high urine calciums, the citrate. So citrate's a protective factor for stones because that's what we call chelate calcium in the urine. It's kind of wraps. It's negatively charged. It wraps around the positively charged calcium. But you give them potassium citrate and it just goes up a tiny bit. So I'll keep pushing up the dose, but you got to be careful because it also alkalinizes the urine. And so then I'm measuring their urine pH when you're doing the 24-hour urine collection. If it gets too high, I'll be like, this is probably the most citrate that you can take because otherwise you're going to start making calcium phosphate stones. Um, so that's something you're right. It's not always, more of a good thing is better.
Yep.
You got to be you have to be cautious there and have it directed. And then as far as the lemon juice, yes. I mean, I'll do that too.
It's not
I
going
had
to
a
hurt
doc.
you,
Well,
but
I had a doc. Well, I had a couple things. I had a doc come to me and he goes, I'm not taking any potassium citrate. Is there some way I can do this dietary? And I said, well, the study says if you take 4 ounces of lemon juice a day,
Mhm.
that's what the study recommended. So he actually got his urine citrate up from like 250 up to like 700
Oh, wow.
doing it. So, I
Nice.
mean, it
Just
worked
a
for
lot of
him.
lemon juice.
There's a lot of lemon juice. And so some people can't tolerate that from a GI standpoint. They'll
Right,
get
right. Or teeth,
abdominal
like lots
cramps.
of
Yeah.
teeth
Oh,
complaints
that,
too.
yes, yes.
Hmm.
So definitely have seen that. Had a lady, she couldn't tolerate anything. She couldn't tolerate the potassium citrate pill. She couldn't tolerate lemon juice.
Hmm.
And so fortunately for her, what I've done in a few people like that, the few people I've seen is I'll put them on potassium bicarbonate.
Hmm.
Because a lot of times the urine citrate's low because patients have this real subtle systemic metabolic acidosis. And your body's hanging onto the citrate to treat the acidosis in your body. So if you can correct the acidosis with potassium bicarbonate, now the urine citrate goes up.
Yeah.
So her urine citrate went from like 200 to 500 or something.
Hmm. Yeah.
But and she knitted me this ornament that I keep in my office for
Oh,
Christmas because I saw her on Christmas and she goes, "This is the first time I got my scan and I didn't have any new stones." Because she could tolerate taking that.
that's
And so,
amazing.
yeah,
Yeah.
so that was a cool one.
Yeah.
And that stuff's so rewarding.
Yeah, that's the best. From a nutrition standpoint, my really the data shows the most effective way to get citrate up from a diet standpoint is to really lower that dietary acid load. So that's really going back to what you mentioned about eating more plant proteins because those are not going to produce acid like animal proteins do, and eating a lot of fruits and vegetables because all literally every single fruit and vegetable under the sun is going to produce base or yeah, produce base during metabolism. And so the more fruits and vegetables that we can get you eating and the less of that non-dairy animal protein, that is going to be the most effective thing that I can do as your dietitian to get that citrate up. And so even if you are taking potassium citrate or any of these other things that, your doctor recommended, you can help them work better by thinking about those dietary things. Like same thing with the thiazide diuretics, right? Like if you're taking a thiazide and it's doing a great job keeping your urine calcium down, but if all of a sudden you start eating a ton of salt, you're going to bust right through that medication. So diet and medications work really, really well together. Not everyone needs to take medications, but also diet isn't enough for everyone, right? Like we really have to be individualized to what's going on in your urine and what you need.
Yes.
Yeah.
Yeah, you sparked my thinking on a lot of stuff there. But
Yeah, that was a
well,
long one.
no, that's good. That's good. The other medicine that I do use is allopurinol or
Oh, mhm.
fluvoxostat for patients that have high uric acid in the urine. And I treat it even if they don't make uric acid stones, if they're making calcium oxalate stones, I still will treat the high urine uric acid because uric acid will precipitate out and it forms a nidus for the calcium to bind onto. And so I think it's a risk factor even for calcium stones. So I personally do treat those people um, with either allopurinol or if the allopurinol is not effective to get their uric acid low enough, then I'll use Uloric or febuxostat is the generic name.
Mhm.
And those work really well. I tell them if I put you on this, your uric acid's going to go from 1,000 milligrams down to 500,
Mhm.
and so it's real effective and it's low side effect profile. And allopurinol is again one of the cheap medicines that you can get.
Yeah. Yeah, it always is amazing to me, when we think about one of the things and the stats that always is thrown out about kidney stones is that they're so expensive because they're so common and they tend to happen to young people who are working. So when you think about it from a, big economy and impact on our how much money we're losing from lost work and the expensive surgeries and whatnot, it's astounding. I think like 5 billion a year is the last estimate that I've seen.
Wow.
And the prevention piece, like all prevention, honestly, in healthcare, but especially for kidney stones, is so cheap. Like seeing a dietitian, not that expensive. These medications, all super, super cheap ones. It's not like these, medications you hear about that are thousands of dollars a month. It's not like that at all. It's super, super cheap. You just have to get a workup and work with someone who knows what they're doing.
Yeah, absolutely.
Mm-hmm.
So, and even if like I'll have people that they couldn't, like the Uloric was $100 a month, which
Mm-hmm.
was tight on their budget. We found it on Amazon Pharmacy for $10 a
Oh,
month.
nice.
So
Yeah.
yeah, so that's how I typically will prescribe it if it's not on their formulary for their insurance plan to make it
Yeah.
affordable.
Yeah. Absolutely. All right. Well, we're nearing the end of the episode. Do you have any last thoughts or things that you'd like to share? I'm sure there's a lot more, but
Well,
anything that
again,
you really want to make sure that you say.
well, I mean, again, my plea is to people that have had, several kidney stones, they're discouraged. By all means, reach out, and we don't want you to suffer any more than you have
There are
to.
things
And
you can do.
yeah, so
Guarantee it.
please do not hide, because it's it's great to find folks like in that situation and help them. So, reach out.
Yeah. And where can people find you if they want to work with you? And who do you help?
So, I mean, I'll help anybody, but I mean, the website for my kidney stone prevention clinic is kspfla.com.
Okay.
It's our website, and you can get a hold of us there. It's got our phone number and email,
Awesome.
etc.
Awesome. And you work a little bit differently than a typical doctor's office, correct?
Yes, so for that business, and I'm trying to figure out the legalities there. For now, I've just kind of committed to folks that live in Florida, because I'm licensed in Florida. But whether I can eventually get licensed somewhere else and or have reciprocity in other
Yeah.
states,
Fingers
that's what
crossed.
I'd like to do. Or like if I'm now I got to look up into this consortium that you're talking about for kidney
Hmm.
stone prevention. Um, but and then I've got a regular practice too for people that live close to Orlando. They would
Hmm.
just come to the office. So
Yeah. Yeah. Awesome. Yeah. Just as I've started working with patients one on one, those legalities of licensure, state licensure are really limiting, especially in a very, very virtual world post COVID, but we'll figure it out.
yeah, I mean, again, so we'll see where this goes, and then stick a lawyer on that one to help me figure that out.
Yeah. Yeah.
So
Yeah. Awesome. Well, thank you so, so much, Dr. Paul, for joining us on the podcast. I think this was a wonderful conversation, and I'm sure that it will help lots and lots of people. I will definitely link to your website in the show notes so people can easily find you. If they do live in Florida and want to work with you or just want to learn a little bit more about you, can definitely connect with him. And yeah, just thank you so much. And to all of you out there, I will see you next week on the Eat Away Kidney Stones podcast.
yeah, thanks, Melanie. Appreciate talking to you.
Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.